Hi, Kevin from Dakota Pharmacy and Dakota Precision RX Labs. We've been featuring some videos on GLP-1s, the weight loss craze that's going on in medicine. I'm here today with nurse practitioner Mick Peterson from Dakota Natural Health Center, and we're going to talk about GLP-1s, both from his perspective as a practitioner and a prescriber, and my perspective as a pharmacist and a compounding pharmacist in particular.
Yeah.
So give me a little bit of a background on what you see in this. Really, I think it's a revolutionary medicine that we're looking at.
Well, again, media is categorizing it as a revolutionary medicine, and I've got a little experience with it from both the weight loss side, but also what the FDA approved it for is the diabetic side. And with my experience with diabetes, it's been extremely effective, and it's been extremely helpful with a lot of patients, not only with their hemoglobin A1C and their blood sugar control, but also they've been able to lose weight. They've been able to curtail their cravings and their want to eat, and their appetite has been satiated a lot more quicker. I have been able to, through a roundabout way, been able to get it approved for some weight loss concerns through metabolic issues and whatnot else. And again, been very successful with these patients on losing some substantial weight. I haven't been prescribing it long enough to really say that I've been able to maintain or get people back off to see if they've been able to maintain their weight off.
Sure.
But it's been extremely beneficial.
So
overall.
have you been exposed to the idea and the fact that the Wild West that's been created has actually created some drug shortage problems in as well?
Yeah. Between that, the issues with obtaining it, and then insurance paying for it, or patients that truly need it for diabetes. Yeah, it's been difficult to obtain it.
I can tell from our experience, these are refrigerated injectable products, and our fridge is packed. It is absolutely packed full of these GLP-1 medications.
Yeah. It's been a huge push and a huge need.
Yeah. So from the perspective of patient safety, and we talked earlier before we went live here about medicine's really a risk to benefit.
Right.
So mediating the risk to reap the benefits, I think, is kind of the magic bullet here. What do you see from either a side effect profile or the risk benefit profile that has impacted the way you see it used?
Yeah, that's a really good point. I every prescription that I write, I try to have a lengthy conversation with a patient about the risks, the benefits, the potential side effects, the drug-to-drug interactions, and everything along those lines, and how do we dose and whatnot else. I also do some extensive testing ahead of time to make sure that they're a good candidate, that do they meet the criteria for it. I'm not going to get into the weeds with all of that necessarily, but making sure that their kidneys and liver and their blood sugars can handle it, and whatnot else is a big important thing. There's been the FDA just released a new statement about the potential improvement or cardiovascular risk reduction associated with some weight loss, which I think is pretty cool. That's new and coming out. But the side effects, primarily GI, right? Nausea, vomiting, diarrhea.
Almost everybody gets some nausea from it.
Some in some capacity, and I've had some patients say I need to have something in my stomach. I've had other patients say I can't have anything, or else I'm just going to get rid of it.
Yeah. So everybody's different.
Everybody's different. Yep.
And I believe the nausea component is really how the drug works. It slows your gastric emptying time. So I think there's some stress on the gastric system.
Yeah. And that's another thing that I try to hone in on when I'm talking with patients about this, about risk of how regular are you? Are you cognizant of that? You haven't, all of those things.
A change in bowel function is a huge deal for these patients.
Yeah, it certainly can be so.
And again, you talked about it a little bit about sometimes insurances don't pay for it. They're expensive.
Yes.
So people using it for weight loss, if an insurance company looks at the diagnosis code and they don't want to pay for a drug that's basically only been approved for type 2 diabetes, there's some options now because some of the newer trade names like Wegovy, they're approved for weight loss, so we're making some headway on that.
Right.
In our world, there's a lot of these GLP-1 injectables being compounded. The way around the patents and the idea that we shouldn't be compounding commercially available products is the drug shortage arena. But I also think it's led to the possibility of making it for the wrong reasons, if you catch my drift, because it's expensive. It can be very profitable. We've heard a few horror stories out there, some pharmacies being shut down because they're just not doing the compounding component correctly, according to the United States Pharmacopoeia or even the FDA.
Right.
And there's an aversion to needles. Sometimes people don't want that needle. So they're kind of left out in the dark, which is kind of why we're here today, because we're going to talk a little bit about a new delivery system that
I'm real excited for this.
Yeah.